I'm Dr. Roger Adams, Utah State Dental Director for Premier Access and Administrator for Utah State Medicaid and CHIP dental programs. I would like to thank the Association for Community Health for hosting this webinar, and especially Courtney for putting all of this together. The CDC confirms that dental decay is the most common chronic disease of children and adolescents ages 6 to 19 years of age. Silver diamine fluoride is rapidly becoming a staple of many dentists and especially pediatric dentists in managing this disease process. It is my pleasure to introduce Dr. Darren Chamberlain, a pediatric dentist in Utah County. Dr. Chamberlain is the immediate past president of the Utah Dental Association and a highly respected advocate for the efficacies and benefits of silver diamine fluoride. Dr. Chamberlain.
Thank you, Roger. I appreciate it. Yes, my name is Darren Chamberlain. I'm a pediatric dentist. I have an office in Springville, Utah, and in Payson. And I have been using silver diamine fluoride for the past 5 years with some very wonderful success stories. And I'm excited to share a little bit about what I've learned along the way, and also give some insights into the best practices for using silver diamine fluoride. Today's lecture, I'll give you a brief outline. We'll start with the history of silver diamine fluoride, the formulation. We will discuss some of the manufacturers that manufacture the product, indications for use, its side effects. We'll go through informed consent, which is a very important topic in silver diamine fluoride, and you'll see some of the reasons why. The application, efficacy, the frequency of use, a technique called the SMART technique. We'll get into that towards the end of the lecture, and then just a few concluding remarks. Silver nitrate has been used for hundreds of years, actually, and in the 1840s it was started to use to arrest dental caries, and for over 80 years silver diamine fluoride has been used in the country of Japan. In the 1970s, Western Australia's school dental service used silver fluoride as part of their treatment process for disadvantaged young children in the New South Wales area. And so this product, silver diamine fluoride, has been used throughout the world for many, many years. For over 30 years, silver diamine fluoride has been used across Europe, and just recently as 2014, the United States FDA gave silver diamine fluoride the approval as a Class 2 medical device, which means that it actually can be used over the counter. And I've actually had some patients that applied it, well, parents of patients applied it to their children and brought them into the office. Somehow they found it online. And so it is something that, that the general public can find and utilize. In October 2016, an interesting thing happened. The FDA awarded silver diamine fluoride the designation of a breakthrough therapy based on its arrest of caries in children and adults. So the original FDA approval was as a desensitizing agent, but now the FDA has realized that silver diamine fluoride arrests caries, and this is the first oral product that is designated as this breakthrough therapy. And there is some significant advantages to having that designation by the FDA. The formulation, this is the exciting part. I hope I don't bore you too much with this, but 38% silver diamine fluoride, and you can see the formulation there. 25% of that 38 is silver. That's the antibacterial agent in the product. It is a broad spectrum antimicrobial with, you can read this right along with me, with high biocompatibility and low toxicity. Silver actually damages and degrades the bacterial cell wall and disrupts the bacterial DNA synthesis and replication, and disrupts intercellular metabolic activity, eventually leading to cell death. What that means is it disrupts bacterial cell walls and kills the bacteria. Now, the very interesting thing about silver is these killed bacteria act as carriers for that silver ion and actually can kill living bacteria nearby. And I wish I was the one to come up with this term, the zombie effect, but this is actually a term that describes this action of these bacteria that are carriers killing the bacteria in proximity to the bacteria that have been killed. This actually prevents a new biofilm throughout the rest of the dentition. So this prevents these bacteria from getting into the surrounding dentition and provides us a very great effect on the rest of the mouth. We know the effects of fluoride. As dentists, this is something that we utilize on a daily basis, hopefully, and that is remineralization of the surrounding teeth, and then the tooth, obviously, they're applied to. And then ammonia is the third component of SDF, and this actually stabilizes the formula. It reduces the oxidation potential of SDF and maintains a constant concentration over a period of time. This renders it safe to be able to be used in the mouth, and actually the efficacy, the shelf life, sorry, that's what I'm trying to come up with. Shelf life of SDF is about 3 years, and that's thanks to that ammonia component. You can see some of the manufacturers of SDF. As I did an online search, I came up with a little more than a handful of manufacturers. You can see some of them are based in Argentina and Japan and India. The two that I'm most accustomed to working with are the one in the US, which is Advantage Arrest, made by Elevate Oral Care. They were the first manufacturer in the United States. Soon after the approval by the FDA, they started making the product in April of 2015. And then Australia is the SDI Limited. They make called a Riva Star, which is SDF and also has a potassium iodine component, and we'll go into that. Those are single dose capsules and are used in conjunction with one another. One is you can see at the top of the page up here, one of them is a silver product, and the other is the potassium iodide, which helps with some of the staining components of SDF. Also, Elevate Oral Care makes a single use product as well, if you'd like to do that. But their bottle is an 8 milliliter bottle. Some of the bottles, like the India bottle, is a 5 milliliter bottle. Indications for use of silver diamine fluoride. It's used for patients with severe caries risk due to xerostomia, severe early childhood caries, which does not typically resolve with operative treatment, babies and toddlers with early childhood caries, and that's where I utilize SDF the most in my practice, is in the early infant and toddler stage. Also used for pre-cooperative children, slow down the progress of disease prior to building cooperation for treatment. Patients with physical and cognitive disabilities or dental phobia, in whom more invasive procedures are not appropriate, and then where aerosol generating procedures are unable to be performed or approved, which is the current environment, this being 2020, and we're dealing with the coronavirus right now. And so this is something that can be utilized if we have a COVID positive patient and we don't want to have aerosols in our operatories. SDF is a great product for the current environment. And also it's utilized for when no or limited access to dental centers, and owing to its ease and use of minimal equipment required. The teeth that we typically apply SDF to are carious primary teeth, showing radiographic evidence of being close to exfoliation, and non-restorable asymptomatic teeth where extraction is contraindicated. And then in our office, we see quite a bit of molar incisor hypomineralization. And so it helps out with dentin hypersensitivity. In fact, that's why it received FDA approval. and it slows down the disease. So those children that come into my practice that have some hypersensitivity on molars that, or incisors that are hypomineralized, we can apply this product and it gives them some relief. It also it is effective with active root surface caries lesions, and then teeth that have no symptoms but have an irreversible inflammation of the dental pulp. That's those are the indications. Contraindications are patients with an allergy to silver. That's very, very rare, but there are patients out there that have a silver allergy or compounds containing silver. Those with ulcerative gingivitis or stomatitis due to pain. And you could manage that by covering the mucosal area. And those that are unable to tolerate treatment. And then teeth with irreversible pulpitis or direct pulp exposure. This is an irritant to the pulp, and so it is not indicated with a direct pulp exposure. And then also when it's not possible to achieve adequate isolation of a tooth and oral tissues. Some patients just will not tolerate it, and unfortunately in those situations we can't use silver diamine fluoride. So this is a slide of the side effects, and we'll show some pictures in a little while here, and you'll see what this black staining is. But the main side effect of SDF is non-medical, and it's just prominent black staining of the carious area of the tooth where that solution is applied. Now, SDF will stain anything that it touches, including skin, mucosal membranes, clothing, and work surfaces. And another side effect is a very intense, bitter, metallic flavor. So those little children that we put it in, we try our very, very best to avoid the tongue, but it subsides within minutes. That goes away. There aren't any serious adverse reactions, nothing life-threatening, hospitalization, toxicity, no record of toxicity or anything with this in any of the scientific literature. And 2 safety studies have been done in children. They've found no adverse effects. Pharmacokinetic studies in adults have found no adverse effects and demonstrated a lack of any increase of fluoride in the blood. There have been slight increases in serum silver were observed, but that's the only side effect. And then systemic reviews reported adverse reactions to SDF. These reactions have been small white lesions on the oral mucosa that healed over the course of 48 hours. And then there's other studies that didn't report any serious effects. So there's still kind of questionable whether those happened or not. I haven't seen really anything that way. Talk a little bit about SDF staining, and it will, like I said, stain anything that comes in contact with, except for very sound tooth structure. So if the tooth doesn't have any caries or any problems with it, it will not stain that area, and that's why it's very, very effective at dentin hypersensitivity. But it will stain the soft tissue surrounding the area, and that soft tissue will be stained for 3 to 4 days, and it can last up to 2 weeks. It will stain countertops, floors, upholstery, anything that it gets in contact with. We can use an ammonia-based product, Windex, to remove it from countertops if it's wet. And if it's dry, bleach helps a little bit, but it pretty much will stain anything that it comes in contact with. And it will not come out of clothing or upholstery, so make sure you use a bib while applying it to patients. This picture here this is actually the one with the smiley face is silver nitrate, but this picture of the fingers and the arms is an outreach program I went with NYU, and that's this finger up in the top is my finger where I got a little bit of silver diamine fluoride, and all of us kind of saw the results of getting that on our own skin. It lasted about less than a week. I would say probably 4 or 5 days, and then the staining was gone. But you can see the same thing on lips, and sometimes they'll ask to apply a little bit of Vaseline to the lips, and that will make it so that it does not stain the mucosa or the lips if you apply that. And then these are some pictures of silver diamine fluoride. This is the results of what it does to carious lesions. And so you can see on this upper left-hand side a before and after picture of that. And actually, this tooth, they applied it, and then the SDF, and then very soon after, shined a curing light over the top of it, and that speeds up the reaction of the silver. And you can see the results of that. But this is why informed consent is very, very important as you use silver diamine fluoride. It will take those areas that are kind of this tannish color where the caries is starting and turn it black. So you can see some root caries here, and then a pit and fissure carious lesion with SDF applied there as well. My personal observation is it's very effective on an open lesion like this one on the upper left in posterior teeth. It's very effective in the anterior, but these pit and fissure carious lesions, it's hard to arrest those because there's so much going on underneath the surface there. And so I have had a very difficult time with those slowing the progression of that carious lesion into the occlusal surface of molars. But we can kind of talk a little bit more about that as we move on. So this is a very important part of using silver diamine fluoride is the informed consent. Parents and patients, if you're using on a dental patient, they need to understand what the consequence of this treatment is. And you can see in both of these informed consents, there are pictures that show what will happen. This one on the left was given to me actually by Roger Adams. This is what Avisis Premier Access uses in their study, and we've used this one in our office on a regular basis. And this kind of goes through what silver diamine fluoride is, helps parents understand why we're doing it, how often we need to reapply it. Also, if there's any allergies to let us know. And then we say what it does. It stops tooth decay and it relieves sensitivity, but the risks are there, and the major risk is that it will stain the area that has the dental caries on it. And we're going to make sure that to do everything we can, but we also have to let them know that if it does get on the clothes or on the surrounding tissue, it will stain those areas as well. And then just a list of alternatives, which include no treatment and then other options. And so we go through all of these with the parent before making the decision whether they or not to use silver diamine fluoride. And it's something that we make sure and have a very, very open communication with our parents before we move ahead and utilize this treatment. And so, yeah, it is very, very important to get a signature there. I've had some parents come back and just say, "Oh, I didn't realize it was going to do this." And we say, "Well, we've had this conversation." And so then we talk about some other treatment options. We'll go through some of those before the end of the lecture. But yeah, and there are informed consent forms. Actually, this one on the right I got from Elevate Dental Care. This was, I emailed them and they sent this copy. One of the groups that works with them use this in their office, and they're very willing to share that. So you can find informed consents online as well. So the application, I'm going to try and work this video if it'll work for me. I may turn down the volume a little bit and just kind of talk through, but you can see that they're starting this. Actually, they start the video with a,
all right, ready, honey?
Let's see here, the application of the Vaseline around the area. I'm going to fast forward a little bit through this. They take a long time putting the Vaseline on and drying the area. And luckily they have got a very, very cooperative patient. Most of the patients that I work with are not quite this cooperative, but she's doing a wonderful job. And you can see they spend quite a bit of time drying the area. I'll usually just use a 2x2 for that instead of the air water syringe, but and then you take a micro brush and dip it into a Diamine dish that has this silver diamine fluoride in it, and all you need is one drop. One drop will apply, the literature says, for 5 teeth. I've noticed I could get one drop to go even a little bit farther than that if I use it sparingly, and but that's pretty typical. Is it can definitely hit the anterior 4 teeth just like they're applying here. Now you can see that they're reapplying, and they're kind of making sure they don't get anything on the mucosa and the gingiva if they can avoid it. They're going to all surfaces of those teeth, and they are applying it and just keeping the mouth open. Luckily, they've got a very, very cooperative patient. Most of the time, I've got a patient that is not being the most cooperative, and we're just applying as quickly as we can. They say that the application should be for a minimum of 1 minute, and as you apply that, and then you can kind of dry it off afterward. But it is very difficult to apply for 1 minute on some of these patients. Now you can already start to see, especially that tooth on the patient's right-hand side, our left-hand side, is starting to turn a little bit dark right around the edges there. And so you'll see some immediate results. And if you were to shine a curing light over the top of those, they would turn black immediately. Now, at the end of this, you're going to see that they apply a fluoride varnish. And this is something that we do in our office as well. And I recommend applying the fluoride varnish to the teeth that you didn't apply the silver diamine fluoride to, because if you apply it to those teeth that have the silver diamine fluoride first and then take it to the other teeth, you will see a little bit of that staining on the other teeth as well. And so we always apply to the unaffected teeth and then bring it to the teeth that we treated with the silver diamine fluoride. And that's exactly how they're applying it as well. If I'm not able to get a full minute of application, I will quickly put the silver diamine fluoride in as long as we can, and then put the fluoride varnish right over the top. And I've had really good results by doing that. So let's see if we can, let's move this way. But yeah, that the application of silver diamine fluoride is something that is not very technique sensitive. As long as you get it on those areas where the carious lesion is, you'll be able to see some pretty immediate results. I'm actually going to stop screen sharing here, and let me see if I can show you how we do this in our office. All right, I don't know about seeing my lovely face, but here we go. This is actually a bottle of the Advantage Arrest. This is by Elevate Healthcare. And what I'll actually do is have my assistant take off the throwaway portion of my needle, the syringe there, and use this as a, oh, what do you call it? The Diamine dish. And so if you take one little drop, and this is, you'll see it's a kind of a blue color, and drop it into the Diamine dish, and then my assistant will hold that, and then the micro brush will, you just bend the end of that micro brush and put it into that Diamine dish, or the end of the syringe, and you can see you put a little bit of that on there, and then my assistant just holds that as I'm ready to go, and it makes it very, very convenient to have that close to the patient's mouth, and so I can just go in and apply it very, very quickly, and you just need one drop, and that one drop goes quite a long way to be able to arrest the caries on those anterior teeth and posterior teeth as well. Darren, so that is something that we do almost on a daily basis. Now you can see the tip of that, I don't know if you can see, but it is turned a little bit black. And if you leave that exposed to the sunlight, it will turn, it will expose all of that to sunlight, and you won't have the longevity of the product. So it is best to cap it. And also, if that spills and gets on your countertop, it will ruin your countertops. So the cap is very, very important. One thing to make note, and I'll just do that while I'm not sharing my screen, is on this product voucher, you'll notice one of the first things on there is indication of usage, that it's for use for adults over the age of 21. And that's just because of this dental hypersensitivity. And the FDA, the only reason they have that listed there is because the FDA gave approval because they only tested patients over the age of 21. But this is very, very safe in infants and toddlers and adults alike. So don't feel like you have to do this only on adult patients. All right, we're gonna go back to that screen share again. If I can get this to work. All right, so this slide does talk about kind of what we'd already gone through. Thoroughly dry the area, apply for 1 minute if you can. Again, the attention span, and if you can apply the fluoride varnish after the SDF, this will keep the silver diamine fluoride on the teeth if you aren't successful in applying for the full minute. And we talked just a little bit about potassium iodide, and we'll talk a little bit more about this as we talk about the SMART technique. The application of potassium iodide immediately after silver diamine fluoride will reduce some staining. I haven't used this. You look at some literature and it's maybe a temporary reducing of the staining. And I think using it in the SMART technique, where you place a glass ionomer over the area that is affected, you won't get as much staining because there isn't access to the air. But it does remove the excess silver ions and by forming a silver iodide precipitate. And what you'll see is when you apply the potassium iodide, the potassium iodide mixes with the silver to create that silver iodide, and it's kind of a white, opaque sludge kind of at the base against where the tooth is, and it will not turn black as quickly or if at all with use. And I wish I'd had a little bit more experience with that, but I just have to read what the literature shows. Billing codes, you can see there's 3 codes that can be used with silver diamine fluoride. A D1354 is the interim application of caries arresting medicament. This is a new code. More and more insurances are covering this code, thankfully. But sometimes in our office, we have to bill out a D1208, which is a fluoride application. And we always put fluoride after the silver diamine fluoride, so we feel comfortable putting fluoride application as a code for this. And then you can also see the D9910, which is the application of a desensitizing medicament. And you can figure out your own fees for those codes. The efficacy is actually, after one application, studies show, and there's ranges of this, but one study that I read, 75% of carious lesions are arrested after one application. After 2 applications, you can see 95% of carious lesions are arrested. And the lesions are more likely to be arrested if you, using a spoon excavator, remove the soft and leathery dentin, the infected and affected dentin, before the application of SDF. So if you can get through some of that, the outside layers of the carious lesion and get something that's a little bit more firm, you will see the area arrest very, very quickly. It does penetrate, SDF penetrates 25 microns into healthy enamel and 50 to 300 microns into healthy dentin. And so, but it penetrates very quickly into the infected dentin, and it'll go even farther than that in non-healthy dentin. Frequency of use, multiple studies recommend different frequencies of use. You can't find a standard of care for this, and so you do what works best in your practice. Silver diamine fluoride is safe to use with in relatively short period of time. Again, like we said before, blood drawn after SDF placement shows no increased levels of fluoride. I've seen studies that show a second application may be placed after 1 week. And so if you want to have that 95% efficacy, you can apply it 1 week after the initial application. If SDF is placed and patients monitored, it is recommended that silver diamine fluoride be reapplied at least annually to maintain its efficacy. I've seen some offices that will do it every 6 months. In our office, the protocol is to place all patients that are we've applied SDF on a 3-month recall. And this allows us to frequently monitor the carious lesion and also reinforce hygiene with the patient. Obviously, if we've got this kind of a lesion, hygiene is something that we need to make sure that patients understand is very, very important. And then at that 3-month recall, if we need to, we can check the lesion. If it's hard and solid and it feels like it's arrested, we don't necessarily need to reapply the SDF. If it's in that 75% that's arrested, if it is the 25% that still feels a little bit soft, then we will reapply at that 3-month visit. And then it also allows us to evaluate for new carious lesions and treat them if necessary. And parents have appreciated coming in every 3 months and us monitoring this. And what we'll do in our practice is, this is something that I will use as a patient gets ready to, it gets old enough for us to be able to treat them, whether it's in a normal dental setting or in our office. We typically don't do oral sedations, conscious sedations until the age of 3. And so sometimes parents will wait. It's a little bit less costly to do a conscious sedation than it is to do an IV sedation or take a patient to the hospital. And sometimes we're waiting. I won't do IV sedations in my office until the patient is 2. And so we're waiting for that magic age of 2 or 3 for the patient to be old enough to be able to fix the teeth. And then that allows us gives us some time to be able to get the patient mature enough to be able to handle a sedation in our office. That is something that is just our protocol in our office, and it's been nice for parents in that they understand that it is just a temporary thing, and then we'll be able to restore these teeth very quickly once we're able to do it in a proper dental setting. The SMART technique, we've talked a little bit about this, is a technique where silver diamine fluoride is used in conjunction with a self-cured glass ionomer over a carious lesion. And so you can kind of see a few of these pictures here. Using a self-cured glass ionomer is important because, as we talked about before, a light cure will stain the area very quickly. And you'll see, kind of like in this upper left-hand picture, you'll see a restoration that has the borders of it have kind of a stain in it, and it looks like it has caries around the edges of that restoration. And so if they were to go into another practice, they would probably remove that restoration. And so you have to really have good documentation that you used a SMART technique when applying silver diamine fluoride in the glass ionomer. The very top picture right here shows the use of silver diamine fluoride and then a glass ionomer straight over the top of it, a self-cured glass ionomer. And then this shows kind of using that spoon excavator to remove gross caries before applying a glass ionomer over a canine, a permanent canine. This is an ideal time to use that potassium iodide after an SDF application because you will avoid the staining. But you have to be very, very careful when using potassium iodide because it is caustic, and we will see that if it gets on tissues, it will cause some damage there. And so as you use potassium iodide with silver diamine fluoride, make sure that you are avoiding any soft tissue coming in contact with that potassium iodide. It can be used as an indirect pulp cap, and we talked a little bit about that. It does create a sclerotic dentinal barrier, and you can actually see that on x-rays as you take follow-up x-rays of the area, and it will protect the pulp very, very well. And this is something that we've used quite a bit in our office. And again, we see areas that I think, oh, there's no way we're going to be able to save this tooth. And they come back 3 months, 6 months, a year, 2 years later, and the tooth is intact and doing very, very well. And it's thanks to the effects of the antibacterial effects of the silver. Silver diamine fluoride is contraindicated if there is a pulp exposure. SDF is a pulpal irritant. And so if there is a pulp exposure, you have to place something over the top of that pulp. And in our office, we use a product called Biodentin, and then we put a glass ionomer over the top of that. And once it's protected, you can use SDF if you need to, if there's still caries there. Research does indicate that SDF will increase the bond strength of glass ionomers, which is a good thing. And so you'll see that the glass ionomer will actually stay in better if you put silver diamine fluoride down. And the bond strength of composite resin is not affected by SDF placement. And so we will go in and restore teeth treated with silver diamine fluoride with a composite resin, and we've had just as good a success doing that as if we had removed the caries before. Now, when we do that, I make sure and remove all of the black staining before we put down the composite resin. And we've also, like that patient that we saw the video of, those would be teeth that would require crowns, and we'll put a zirconia crown over the top of those teeth. And sometimes even in removing, I'd remove all of the decay because I don't want anything underneath that. And sometimes even removing that decay, there isn't enough of a sclerotic dental barrier, and we have to do it. We get a minor pulp exposure, and we have to do a pulpectomy if needs be. But usually we will see that there won't be a pulp exposure, and we can just restore with either a composite resin or, like I said, a zirconia crown over the top of those teeth, something that's aesthetic. And so we're getting fairly close on time. But in conclusion, you can see that silver diamine fluoride's primary purpose and why it received FDA approval is as a dental desensitizing agent. I realize I didn't talk much about the application in the elderly and those in nursing homes and maybe not able to stand a normal dental visit, but it works very, very well in desensitizing, and it creates almost immediate pain relief. And it works on exposed roots as a liner when restoring deep carious lesions. And again, it does not stain healthy tooth structure, but it does arrest decay. And you have to make sure you're communicating with patients and parents before the application. And SDF is safe with very few risks. And so in our practice, again, we'll use it on those anterior primary teeth that show large carious lesions and early childhood caries. I'll also apply it on soon to be exfoliating primary teeth on the preteen children that are in mixed dentition. If we've got a year or less with a tooth, we can apply a little bit of silver diamine fluoride, and then a lot of times the tooth will exfoliate before it gives the patient any problems, and then the parent isn't having to pay for a restoration and a tooth that's going to be out within a year or so. And then we will apply it to molars that have enamel hypoplasia, and it works really, really well as a desensitizing agent, especially if the molar is just erupting and the patient is really having a lot of cold sensitivity there. We can apply a little bit of silver diamine fluoride to that area, let the molar come in, and then we can look at either restoring with a composite or placing a stainless steel crown over the top of that, just to get the patient out of out of pain there. And it is a very, very good tool to have in a preventive arsenal. It works really, really well in certain situations. It's not in everyday, well, in our practice, we almost do use it almost every day, but it isn't for every patient at all the time. But for those patients where you can utilize silver diamine fluoride, it is very, very helpful. And so I got to go to that slide just because that's one of my favorite pictures. It's what we're trying to avoid in the elderly is losing teeth like that. But I'll go back because on this slide right here, we have Roger Adams' contact information. And if you have any questions or want to follow up with him, we have some information there for Roger Adams here, who's the Premier Access Dental Director. And we appreciate Roger for putting this together and giving an opportunity to kind of talk about silver diamine fluoride. And like I said, this has been something that has been very, very useful. It's great in the current environment with COVID-19. It's something that will be utilized quite a bit as teledentistry is going to be used more and more in the state as we send hygienists and assistants out into the community. They will be able to utilize silver diamine fluoride to arrest caries in an off-site environment in schools or in nursing homes to be able to arrest caries, and it gives us a way to be able to stop disease until a patient can get into our practice and be able to perform a more definitive restoration. So we're grateful for a product that, like I said, I've been using for the past 5 years or so, and I've seen some really, really good success. I've seen some areas where, again, it hasn't been quite as successful in those pits and fissures of posterior molars, but in those anterior teeth. And you can actually, I've seen some techniques where you can arrest interproximal caries by taking a bit of, what do you call it, a thicker floss, applying to it and pulling it through those areas. You can actually arrest interproximal caries as well. So there's a few other applications, and you can go online and find some of those applications if you really search. Anyway, we'll turn the time back over to Roger.
Hey, thanks, Darren. Your presentation is exactly what I was hoping, particularly for the community health centers, as we're trying to expand their opportunity to deal with these kids, particularly in the outlying areas of Utah. Currently, silver diamine fluoride, or SDF as it's often called, is not a covered benefit under the Utah Medicaid and CHIP programs. Premier Access feels very strongly that silver diamine fluoride should be a covered benefit under Medicaid, and we have discussed this, and the Department of Health does support an initiative that we started in January of 2019, where we started an SDF, or silver diamine fluoride pilot program, where we identified 10 dental offices along the Wasatch Front, and we are reimbursing them for the use of silver diamine fluoride. In January of this year, we expanded that offering to more than 100 dental offices statewide. What we're doing is gathering information and data utilization factors to help the Department of Health determine what the proper pricing or reimbursement would be for this procedure. We'd like to include all of the Utah Community Health Center dental clinics across the state in this project. Darren put on the publication, so you'll see it on the website. You certainly can contact me via email at radams@avisus.com, or you can text or phone me at 801-450-6040. This concludes this primer on silver diamine fluoride. And again, I would like to thank Darren for this presentation. As you can tell, he's an excellent pediatric dentist, and certainly understands the efficacies of this product. So Courtney, with that, I think we can stop the recording.
Well, Roger, before we stop, I just want to say thank you for your efforts in in trying to get silver diamine fluoride to be a covered benefit by Medicaid. This is something that we at the UDA have been trying to do for quite a while, and we hope that in our combined efforts we'll be able to see some success here. And it is something that is a great advantage, and it's an opportunity for us to be able to provide access to care for patients that don't have access anywhere else. And so we really, really appreciate what your efforts and what you've done in this regard. And we hope to continue to work forward, and hopefully we'll see some good results at the end of this. So thank you very much.
Thank you, Darren.